really thrilled to have this wrap-up panel on the topic from measurement to action, translating data to decision-making. And so I'll go in the order that folks are listed here on the panel, but I'll introduce everyone to begin with, and so you can just pass the microphone. Our first speaker is Bryce Bird, right here from the Utah Department of Environmental Quality. Then we'll have Michael Cheeseman from NOAA. Then Kevin Cromar from New York University, but who is our local host. Thank you, Kevin. And wrapping up with Gaige Kerr from George Washington University.
Thank you very much for being here. Just to put some context for those of you who haven't visited Utah a lot, you're visiting the capital city and got to see this area here. Utah is a little bit unique in that it is a large western state, but it's also one of the most urbanized states in the nation. The majority of Utah's land is owned by the federal government and therefore is not able to be easily developed. And that has resulted in the fact that 90% of our population lives on 1.1% of the state land. And the challenge we have, of course, if you've looked around our beautiful valley here, we're bounded on both sides by mountains. We have the urban center. It is also a transportation corridor for the West, where shipping pretty much from Mexico to Canada, the coast to the interior comes through Utah as well. That has led to some unique air quality challenges. And the fact that our population lives at the bottom of the valley, we have both winter air pollution, PM 2.5, where we exceed the national ambient air quality standards. We have summer ozone as well. Some of the other challenges where we have the industrial sector is also in that same area where we are able to grow and populate. And then we're also one of the fastest growing states in the nation. So one of the statistics that scares me every year is just since I've been air quality director, our vehicle miles driven in Salt Lake County have gone from 30 million miles a day to 55 million miles a day. So as we're growing, we're building further and further out from our job centers. And so we're seeing increased vehicle traffic. And of course, when we look at air quality challenges, we're very limited on what we can do as a state. There are some preemptions in the Clean Air Act that give us challenges. And so we keep focusing our air quality efforts on the same sources over and over again. And so what we can easily regulate has already been regulated, and we're left with more and more broad impacts or just things we can't do. And so perpetual non-attainment. Of course, you're familiar with the air quality regulatory process. So we interact with science in really two ways, and that is on the health side. So Congress charged EPA with developing health standards that were protective of the public with an adequate margin of safety. And so independent science advisors look at all of the available research data. A lot of that research happens in our area because we have some other unique situations, and that is we have very poor air quality at certain times, especially during those winter version periods. But then a week later or a day later, we have fantastic air quality during much of the year. And so there's lots of really good on-off studies for those correlation studies. I guess that's a good thing and a bad thing. It's a bad thing for, of course, the people that live here. It's a bad thing for policymakers, helping them understand that we need to have the authority, we need to have the resources to develop implementable air quality policies here in the state, but do it for only a few days a year and look at the balancing the impacts. Just highlight the mission of the division is under the department's mission, that is safeguarding and improving Utah's air, land, and water through balanced regulation. So that balance is always a kind of that intersection between good data that says that air quality is impacting public health, good data about what the sources of that air pollution are, whether it's local sources, whether it's meteorology and atmospheric chemistry that maybe we were dealt a lucky hand, but we still have to deal with, or whether it's transported air pollution that's impacting our area. And I think it was highlighted on some of the slides today, especially in the ozone presentation, the east and the west difference. And that is when we look at our non-attainment here for ozone along the Wasatch Front, as much as 90% of the pollutants that drive the formation of ozone are not locally produced. So they're transported or they're natural. We have biogenic impact. What we can control is that 10% that we can control locally, but yet we're preempted under the federal regulations from the majority of those sources. So there's only about 20% we can actually influence with our regulatory actions. And so that's been a real challenge for us. And that's probably my final ask here as I kind of wrap up that quick summary is what does that mean for all of you who are working in this field? And that is Utah is accepting of anyone who wants to work in the air quality space in this area. We have some unique challenges. We have some great scientists that work here and made great progress. We've attained every standard over time. Of course, even as that's ratcheted down, it takes us years to do that sometimes, but we have a great history of identifying effective emission controls, which are balanced in nature so they can be effective and implemented, and then still have one of the fastest growing economies in the nation, and it's still a great place to live, work, and recreate. So that's what we're always trying to do. And so our connection between the work you do and the work we do is helping us identify the sources of air pollution that impact public health, identify the reasonable strategies in combination with the engineering work is the other intersection that we have with science is what can be done to reduce those concentrations. And then since we're, again, a mature air quality program, being able to have a scalpel to make the cuts, identifying what actually will make a difference. As we, of course, focus on indicator pollutants, that's where a lot of the correlation health studies were based on. But of course, as we learn more about the atmospheric emissions in our area, we have now photochemical assessment monitoring happening here in the valley, so we can understand the actual species of volatile organic compounds and then the reactivity, and be able to identify again which levers we can turn, which sources we can actually focus on to make those controls that actually result in that improvement in public health. So again, welcome to Utah. Appreciate you all coming here, spending a few days with us, and you enjoyed your time here. And again, if everyone has a research need that's focused on either transport of ozone precursors, Western wildfires and exceptional events, even winter ozone formation, which is unique to us. We've got the Uinta Basin where we form ozone at below 0 temperatures in the middle of winter, which is also fascinating as well. So if you have an interest in that and want to take what you've learned in other areas, help us apply it here. Be involved in the regulatory process. So when we publish proposed rules, invite you to bring your expertise and look at those and give us information. And last thing I want to say is thank Kevin Cromar, who's adopted our area as his residence, even though he focuses work around the country. I think he's instrumental in inviting you all here, but also serves on our air quality board, so brings that expertise into actually making those policies translatable and effective for our area. So thank you, Kevin.
Hey everybody, I'm Michael Cheeseman. I'm here actually presenting sort of on behalf of Shoba, Kondrungata, and NOAA, and some of my work and some of Hai Zhang's in our research group. And we're kind of looking at more of a big picture idea of how satellite observations can be used to drive policy formation moving forward, especially in regards to fine particulate matter. Sorry. Yeah, so I don't need to tell this group, but fine particulate matter has been decreasing from anthropogenic sources due to increasingly improving regulations. Sorry. So we have the NAAQS PM2.5 standards that control both annual average and 24-hour average PM2.5 concentrations. And so from anthropogenic sources, most of the US is actually in attainment of meeting these standards, except for some of Central and Southern California. But exceptional events like wildfires, for example, the Canadian wildfires we saw this summer, can undo years of progress due to these regulations. So here I'm showing you a small animation of some of the smoke being transported from Canadian wildfires into the Northeast US. And here's a analysis we did using a composite of a week in June PM2.5 concentrations from the VIIRS satellite. And I'm showing here actually locations where different populations were exposed to concentrations that were in different AQI categories. So in the red, you're seeing populations that were exposed to at least concentrations that were unhealthy for sensitive groups, or USG, and then unhealthy to very unhealthy and hazardous along that color bar. So in a total, we see we estimated that over 60 million people were exposed to what we would consider hazardous air pollutants, or potentially exposed, depending on their behavior. This smoke, we already know, is leading to exceedances of this annual standard that then needs to be considered an exceptional event, and that puts burden on the regulatory agencies to prove that it's due to smoke. But we can use satellite observations to separate out this non-smoke, smoke and dust PM2.5 and show that smoke is impacting these regions. So here I'm showing you a map of work that we did with VIIRS PM2.5 and showing regions that were exceeding this annual average standard of 12 micrograms per meters cubed between 2018 and 2020. And so in the yellow, I'm showing you our estimate of VIIRS PM2.5, where from all sources, so this includes PM2.5 from smoke and dust. And then in the red, we estimated where there was no smoke or dust present, and you can see that our anthropogenic PM2.5 tends to agree roughly with this area of exceedance in California. But then the West, these regions are primarily driven by the contribution of smoke and dust. And we expect that these regions will continue to be impacted and increasingly impacted due to the increase of PM2.5 emissions from smoke. We're seeing here, I'm showing you the trend of increased PM2.5 emissions in the Western US. So we can use satellite observations to help us improve our daily air quality alerts, and satellite data is already being used by several organizations for daily air quality alerts. Here I'm showing you a map of 24-hour average exceedance of the NAAQS PM2.5 standard estimated by VIIRS. So this is the number of days that the VIIRS satellite would actually say, okay, here we're actually in exceedance of that EPA 24-hour standard. And you can see, due to the wildfires, that is mostly in the Northern California. So, but we can also zoom back and look at these annual average exceedances again and say, okay, what regions are in non-attainment? Here I'm showing, and how might our future policy changes shift what this landscape of exceedance looks like. So here I'm showing you again that map of the current exceedance of 12 micrograms per meters cubed in 2020, where you have the anthropogenic in red, and then all sources that includes mostly the impact of fires in yellow. But if we were to say reduce that NAAQS air quality standard to 9 micrograms per meters cubed, I'm showing here on the right, that actually vastly increases the area that could potentially be an exceedance. And we're seeing even more impact from smoke. And then here in the Southeast, we're seeing what we saw was anthropogenic, but that's actually likely transported smoke that the algorithm didn't pick up. But here, so you can actually see, we show an estimate of the population in exceedance from the VIIRS in the bottom right of each plot. And you can see it almost, it more than doubles the number of people that are in these regions of exceedance. And this can put an undue burden on local agencies then to show that they had to deal with an exceptional event. So some of the new rulemaking that the EPA might that might have an impact due to this change in standard is, because of regulations, we could see improved air quality for many people, better health outcomes. That's the goal. But the downsides, then again, you have to scramble to meet these new standards, and that could lead to a lot of policy changes. And it's unsure what we're going to target, because a lot of the primary emissions, anthropogenic sources especially, have already been reduced. And so there's more research needed on these secondary PM2.5 formations and effective policies. And then there's also a fear that because of this new standard, there might actually be a reduction in prescribed burning, because then that will put a lot of pressure. Like local agencies won't want to burn because then they have to go through the process of applying for an exceptional event. So one way that we might be able to deal with this issue is creating tools, and I've already seen some really great examples of these tools presented here at this conference this week. But looking at ways to, again, screen out this smoke and dust and giving these tools to regulatory agencies so that they can hopefully expedite this exceptional events process. So we created a tool, again, where we're taking the VIIRS aerosol output depth, and we use the AirNow PM2.5 monitors to generate daily VIIRS PM2.5 estimates. And then we use the increased spectral resolution of VIIRS to separate out the dust and smoke fraction, and we can have then estimates of PM2.5 from the anthropogenic sources for the dust and smoke. And then hopefully NOAA might be able to use the smoke PM2.5 analysis in new rulemaking and the smoke and dust to help with expediting the exceptional events waiver. And that's all I have today. Thank you very much.
Stand on this side. All right, I'm going to just make one point in my talk today about translating science into public decision making. And I'm calling this talk Good, Better, Best. So I'll tell you what are good, better, and best ways to translate science into public decision making. And after I tell you how I'm categorizing it, I'll then do story time with Kevin and give you guys some examples, okay? All right, so what is... good. It is good to pull in scientific research and evidence for decisions that have essentially already been made. Okay, and we'll give examples of this. It's better if scientific evidence can act as the motivating rationale on the front end to help us know where we should target our efforts. Okay, but it's best if we can use our scientific research to inform policy details of our public decisions. Okay, so this is what I want you to take away from my talk, and then I'll give you some examples here that illustrate each of these. I could have spent the whole afternoon going over bad examples. There's many policy decisions that have all sorts of underlying rationales. Let's not focus on that. Let's focus on good, better, and best. All right, New York City, they're gonna have a congestion pricing scheme going into effect next year. This essentially is in lower Manhattan, the colored area here. You have to pay to drive in that part of the city, okay? It's different than a regular toll. A toll for a bridge or a tunnel or an expressway, that's a user fee. So you use those toll dollars to pay for capital costs or maintenance of that facility. This is not a use fee. This is a do not use fee. And they intentionally set a price to discourage those who are unable or unwilling to pay that money to drive in that location. New York City tried to do this about 15 years ago, 2007 and 2008 during the Bloomberg administration. And they spent a lot of effort developing the policy. They waited until about 2 weeks of their rollout to go to the health department and say, hey, by the way, what are going to be the health impacts of this policy that we're thinking about? The health department told them that it was impossible to do an estimate in that time. There was a little bit of tension, I was told, in that meeting. If they would have done that analysis, what they would have found is there's actually very little air quality benefit and even less health impact, okay? So even though these congestion pricing schemes, very effective at raising revenues, it doesn't significantly benefit air quality, okay? I want to share this example because Utah is actually implementing our own congestion pricing scheme in the canyons that a lot of you visited yesterday. They want to charge you $30 every time you drive up. They've done no studies of any sort. But if they were, it's not going to have any air quality impact, but it will do a great job of raising funds. Okay, let's go to a better example. The better example that I'm going to share with you, this is chlorpyrifos. You can tell this is not my area I focus on. It's a little bit cheating because this is a pesticide. This is not an ambient air pollutant, but it's a great example how science can encourage action that will otherwise occur. There's some great studies that came out that showed that they have neurodegenerative effects in children, particularly in these communities, agricultural communities. EPA had this information, but they chose not to take action on it. They chose to not limit its use. That doesn't fly. Under FIFRA, if you know that there's a problem, you have to take action. And so the decision from the Ninth District Court of Appeals ruled that EPA's own studies and pronouncements are still in effect. It showed that these are harmful chemicals. And this is the worst thing you can say to someone in administrative law. Their actions were arbitrary and capricious, like total burn in administrative law. So these studies actually, EPA had to go back, and they've now limited use of these pesticides based off of that scientific research that was very well done. All right, what's the best way to do it? That last example I gave you, it didn't really inform the details of how EPA would limit those pesticides. It just said, hey, we need to do something about this. I'm going to give you two stories here about informing the details of policy analysis through research. I wanted to share this one because Michael and I had a conversation yesterday about NO2 emissions from New York City buildings. This isn't NO2, this is PM from buildings in New York. We set out to try to quantify what are the air quality impacts of emissions from buildings, what are the health impacts, and then do a cost-benefit analysis on potential alternatives to the status quo at the time. When we did this analysis, we let the mayor's office know we were doing it so they wouldn't be blindsided, and we potentially needed data from them. And since we reached out, they invited us to some stakeholder listening sessions, okay? So I attended these over the course of several months, and they were intense. You had industry groups, the refineries and energy companies, the union that represented the trucks that delivered the oil to the buildings. They did not want to see any changes. They were not willing to play ball. In the same room, you had environmental groups, and they were demanding that we switch to natural gas right away. There's a little bit of irony because those same groups are demanding we never use natural gas again, but this was a few years ago. Once our research was close to completion, I went to one of these stakeholder meetings, which is a single sheet of paper that I printed off and handed out to everyone, had 2 tables on it, and it showed there was a great compromise option. We essentially could get 80–90% of the total health benefits of the most stringent policy for only 10 to 20% of the costs. And when we shared those tables around the room, it was like this kumbaya moment. All that tension melted. Everyone realized, yes, this is a solution that could work. And from that analysis, the city passed 2 new rules that resulted in the cleanest air quality in over 50 years in New York City. So it was a great success of the scientific analysis actually shaped the details of the policy that was implemented in New York City, and a tremendous benefit for the residents there. All right, the very last story I'll share, this has to do with how stringent should we regulate greenhouse gas emissions in the US? That decision is largely based on a value you may not have heard of called the social cost of carbon, social cost of greenhouse gases. That value will tell us how stringent, how aggressively we should mitigate climate change as opposed to adapt to it. We've done a lot of work trying to dig into how health impacts are considered into this value. And what we found is they weren't being considered very effectively at all. We assembled a group of health experts. We improved these estimates, and they're now the basis of EPA's new values that they've proposed to use. Not only is it going to be the basis of essentially every climate policy in the US, we use it locally as well. I was recently on a transportation committee here in Utah, and we use those social cost of carbon values to prioritize which projects we'd select for funding under the new carbon reduction program. This is the table we put together, and those were the projects that we funded based off of that social cost of greenhouse gas value. So it's a great use of this federal value, federal tool for local transportation policy decision-making. I also wanted to point out that we're continuing this work largely based off of relationships we developed here through HAQAST. So Susan Annenberg, who's a HAQAST PI, and myself, Gaige, is on this project, and then some folks at Berkeley and RFF. We've identified that in these social cost of greenhouse gas values, the impacts of climate and air quality and health, say from wildfires or dust storms or induced ozone formation, is totally absent from any policy analysis. That's a problem because these are big climate impacts. The Wellcome Foundation was generous enough to give us $2+ million over the next few years to identify this problem and to work on it. And we'll likely be using this project. There's some ancillary work that will need to be done that we'll likely use for a HAQAST proposal next year. But it really was from relationships from this group that led to this great high impact project. All right, so what's the takeaway? The thing I want you to think about as you leave today, this session, It is really good to use scientific evidence to support public decisions, but it's much better, it's best when our scientific research is used to shape the details and the specifics of those policies. And with that, I'll end. Thank you.
Well, having the last talk of the last session of a conference is a great honor. I want you to all taper your expectations. I think that I have this just by virtue of my last name starting with a K, and I have a bunch of B's and C's with me. But on that note, I'm Gaige Kerr. I'm a senior research scientist at George Washington University in DC. I'm going to talk today about connections between the warehousing industry and air quality in the US. So I want to start with a question for all of you. Who here has Amazon Prime? Show of hands. It's what, maybe 80, 90%? I'm a Prime user myself. A couple of weeks ago, I was at home at night. I made myself a Gibson, which is an adult beverage. I was spearing some cocktail onions and homemade pickled beets with a little Q-tip, a toothpick. And I thought there's probably a more sustainable way than using a wooden toothpick every time. So I went on Amazon and I found some metal kind of cocktail skewers, ordered them. By 10 a.m. the next morning, they were at my door. Now, of course, at 10 a.m. the next morning, I wasn't having my cocktail. I was busy doing science. So that overnight delivery was a little overkill, but it speaks to this enormous infrastructure we have in the US by which we can move goods really quickly via planes, via semis, via delivery vans. And as you might expect, the transportation infrastructure needed to have that goods movement might generate air pollution that might be of concern for public health. So this was a key concern that was raised by some stakeholders that we work with, including the Environmental Defense Fund and folks at the South Coast Air Quality Management District. And we were able to receive some funding from NASA through the rapid response mechanism that John mentioned yesterday during his opening remarks to investigate this problem. So I'm up here representing a team of folks from Georgia Tech, from Emory, and then from my home institution of GW. And specifically today, I'm going to be detailing some results from a nationwide study, again, looking at warehousing and air quality. And this study was done in collaboration with Susan Annenberg and Dan Goldberg, who are with me at GW, as well as Michelle Meyer and Josh Miller at ICCT. So warehouses are everywhere. We were able to obtain information on warehouses from a commercial real estate data set called CoStar. And what CoStar taught us is that there's about 150,000 warehouses scattered across the US. What you're looking at in this map is a metric of warehouses per capita in US counties. And you can see that the distribution of these facilities is extremely heterogeneous. There are some counties that you might expect to have a large number of warehouses per capita, like LA County in Southern California, as well as Cook County, where Chicago is in Illinois. But then there are some results from this map that really surprised me. One of them in particular, I don't know if I have a laser pointer, but one of them in particular is the Bakken region in North Dakota, where there's lots of oil and gas extraction. And in this region, believe it or not, the warehouses per capita actually exceeds that in LA County. So a massive number of warehouses per capita. Now, when it comes to what an average warehouse looks like, that's changed a lot over the last 10 years. What's shown in this plot are some statistics concerning warehouse characteristics. Most of them should be self-explanatory. The one that maybe isn't self-explanatory is the clustering metric on the top right. What clustering means in this study is the number of warehouses that are crammed together in a given census tract. And what we noticed from this plot is that back in the 1980s and 90s and 2000s, any new warehouses built kind of all were similar in size and similar in their ability to attract traffic. But then there's this inflection point starting around 2010, where there is a massive increase in warehouse size and in their ability to attract traffic. And what I find super notable is the 400% increase in the number of loading docks built at the average new warehouse between 2021 and 2010. So again, this should motivate all of us to question the air quality impacts that warehousing and the warehousing industry has. So since this is a remote sensing crowd, I want to spend a minute or two talking about how we were able to leverage NASA or ESA satellite data and connect it with the warehousing industry. What you're looking at on the plot on the left is tropomine nitrogen dioxide, or NO2 pollution, for one particular warehouse. It happens to be in Laredo, Texas. And since there are different prevailing wind directions at different warehouses across the country, we artificially rotated the NO2 plumes from tropomine in the direction of the prevailing wind So you can see that for this warehouse in Laredo, most days have winds from the southeast. So we took that information about the wind and then rotated the NO2 measurements from Tropomi such that downwind is going to be to the right of that composite shown on the right-hand side of the screen. And we did this daily at each of the 150,000 warehouse locations and then averaged these wind direction adjusted measurements over all days in 2021. And once we do that, we end up with a composite like you see here. So again, this is the average wind direction adjusted NO2 over all warehouses in the US in 2021. And what you can see from this plot is that there's this kind of distinct bullseye pattern where you have higher NO2 levels slightly downwind of the average warehouse location. And there are different ways we can try to quantify the NO2 enhancement. The one I'm using here is we're looking at the difference, the relative difference in NO2 levels between that maximum, that bullseye downwind of the warehouse, and then the left edge of the composite, which represents kind of what we think is clean air flowing into the system, so to speak. And if we define the enhancement in that way, what we find is that there is on average about a 20% increase or enhancement of NO2 slightly downwind of the warehousing facilities. Now you could look at this plot and say, Gaige, maybe there happens to be a power plant by each warehouse that's leading to this enhancement, or maybe there's a bypass or interchange. And so we thought about that and tried to connect warehouse characteristics with the NO2 enhancements. So what's shown here is how NO2 varies across different population density environments on the basis of warehousing loading docks, warehousing parking spaces, and then that clustering phenomenon, which again is the number of warehouses in each census tract. And what we see is that for the low and medium population density environments, there are nearly monotonic increases of NO2 as the number of loading docks and parking spaces and clustering increases at each warehouse. When it comes to those high population density environments, which are again shown on the right, there's a little bit more of a muddled signal, which likely stems from the fact that there are other co-located NOx emission sources within these urban or highly populated areas. So for those of you who have heard me speak before, you know I'm interested in thinking about the ways that emissions and air quality affect different population subgroups. And we did an analysis looking at the location of warehouses and how this stacks up with different demographic groups. So let's first focus on the left-hand side of this plot to the group of bars that's labeled any. What this represents are the demographics in census tracts that contain any unspecified number of warehouses against national median values. So what we see here is that in census tracts that again have some number of warehouses, that number unspecified, there tend to be fewer white and non-Hispanic residents, and then a larger share of residents who identify as a racial or ethnic minority. What's really alarming to me is how the demographics change on the basis of that clustering phenomenon. So that's what's shown with the clustering decile on the right-hand side of the plot. So if you're looking at the first decile, that's going to represent census tracts that just have a single warehouse in. And what we see from this analysis is that those census tracts with just a single warehouse tend to actually have a higher percentage of white and non-Hispanic residents. But as we increase the number of warehouses in each census tract and get up to that 10th decile, which represents census tracts that literally have over 200 warehouses in, believe it or not, we see really dramatic increases in the fraction or proportion of the population who identify as Hispanic or Asian, Native Hawaiian, or Pacific Islander. And some of those anomalies or differences are on the order of 200 to 300% higher in those census tracts. So since this is a data to policy session, I want to close out today by talking about ways that this research can inform policy. Hopefully this goes without saying, but we don't think the actual warehouses themselves, the physical buildings, are causing air pollution. Rather, it's the traffic that's coming in and out of the warehousing facilities really at all hours of the day. I wasn't able to show this today for the sake of time, but we've done an analysis looking at road segment-based truck traffic across the US and shown that there is increased truck traffic near warehouses. So with that result in mind, any policies that we design to try to reduce pollution due to warehouses should target this on-road transportation sector. So to that end, I'm happy to report there is some forward progress thinking about ways we can reduce emissions at the tailpipe. One example of that is back from December of last year when the EPA announced their clean truck rule that would slash emissions from heavy-duty vehicles beginning in model year 2027. So that's definitely a step in the right direction. but there are ways that we can even go above and beyond this. And just a couple of weeks ago, it was announced that California had their warehouse indirect source rule approved, by which emissions that stem from the truck traffic that warehouses attract are offset through other means. And finally, there are some examples of individual companies going above and beyond even these couple examples here. So one that I like is the Frito-Lay company, that they were so forward thinking when it comes to air quality. But this schematic is from, I believe, one of their facilities in Modesto, California. And maybe it's hard to see, but hopefully you can read some of the text that shows that green and more sustainable technologies are really permeating every part of their manufacturing and distribution process at this particular facility. So as you're moving goods within this facility, they're using battery operated forklifts. As you're moving goods from this facility to other locations, there are zero emission vehicles and charging ports and the like. So we're right at 12:30, so I won't go through my conclusions, but I'd encourage you to reach out to me if you have any questions or comments, and thank you all for your attention.
I love this group of talks that I think really captured many of the themes we've been talking about this whole meeting, from environmental justice, wildfire smoke, the needs of air quality managers and health assessments, climate change solutions, partnerships, and much more. So I'd like to use my role here at the podium to just say that we can run maybe 1 minute, even past the real clock time, and have a couple closing questions for our distinguished speakers.
This is in support of your research. Yes, PM has been reduced significantly. Port of LA, Port of Long Beach, it's been reduced 70, 80%. But I come from an NGO and I grew up as an activist since I was 16, and I'm suspicious of all data. I therefore asked the Port of LA, et cetera, government officials, et cetera, show me a corresponding public health study that shows there's been a 60, 70, 80% improvement in public health. Because I know there has been an improvement, like this much. But why hasn't there been this much equal to that? It's because the PM 2.5 and 10-point standards are no good anymore. It's already been proven by hundreds of studies. Ultrafine particles 1.0 are being sucked right into your bloodstream through your lungs and through your dermal skin. And we need a 1.0 standard to really show the public health benefit in addition to the clean air.
Thank you. Anyone want to comment on the tightening of the PM 2.5, even the existing one, is a hot topic. And the idea of moving to a finer standard. Comments on that?
Yeah, we're always looking for those public health benefits, and then also a lot of the regulations are also focused on the cost savings from the medical community that's related to that health benefit, and we're not seeing many of those either. But when you look longer time, big picture, we can see it here. I mentioned that a lot of health studies are happening here. We are seeing improvements over time. Certainly, we also understand that the indicator pollutants are not the only thing that's causing that exposure, and so understanding air toxics and understanding disproportionately impacted communities is something that really isn't represented in the current Clean Air Act system, where you're looking at broad population studies and representative monitoring that doesn't look at the individual's impact.